Sir. The gentlewoman from the 18th, Representative Gilchrest.
Thank you, Mr. Speaker. I want to start by saying I have a great deal of respect for the good chairs of the Appropriations Committee and the Finance Committee and all of the staff who have put in hours upon hours in this budget, and am very pleased that there are much needed investments in education to help our towns. But with that said, just this week we learned that revenue projections for the next fiscal year and this fiscal year are more than $580 million. And with this news, rather than it being all positive, this news came with a warning to this legislature not to spend recklessly. Since 2008, and you just heard my good ranking speaking to this, since 2008, we have not raised Medicaid rates for a number of providers here in the state of Connecticut. These are nurses who go into homes to administer medication. These are clinicians who work with children who have autism. And by not increasing Medicaid rates, we are impacting small businesses who employ these providers. We are sending Connecticut's workforce to other states who pay higher Medicaid rates, and we are impacting the entirety of the healthcare system. We're also denying people access to care, because when we don't pay rates, that means that people can't be employed, and then people are denied the care they need. We're also not paying our nonprofit providers here in the state of Connecticut what we owe them. These are folks who provide services to those who are homeless. These are folks who provide services to those with intellectual and developmental disabilities, those who have experienced domestic and sexual violence, those who have mental health conditions or substance abuse. When we don't pay our Medicaid rates, when we don't pay our nonprofits what we owe them, Connecticut is contributing to creating the working poor. And so, upon hearing the significant increase in the revenue projections this week, the message was clear to this legislature. We were told to make strategic investments, pay down our debt, and keep Connecticut on stable financial ground. Well, I believe that paying Connecticut's nonprofits and social service providers and our healthcare workforce is a strategic investment. I believe that we should pay off our debt, but not at the expense of our citizens being paid a living wage and people being able to access the services they need. And I believe that we can't consider ourselves on good financial ground if we're not paying our bills. And we owe our nonprofits and our Medicaid providers money. So in the next fiscal year, analysts are projecting $375 million more in revenue. And rather than 80% of that going to the savings program, I hope a greater percentage of the tax dollars our citizens pay into this government is reinvested in them. Thank you, Mr. Speaker.